Hi, Paul Williams here again, talking about my experiences with the treatment for mycosis fungoides, my total lymphoid irradiation and subsequent stem cell transplant. Still here in the hospital. I'm now just over 3 weeks in. I completed my TLI at the end of the second week. That experience got better as time went on, which is probably to be expected, and my terror was greatly reduced by the end of it. I didn't appear to get any material side effects from the irradiation, although I think I probably was feeling a little bit weaker. Following the TLI, which I had 2 treatments on the Thursday, and then the Friday I had my stem cell transplant. I had 8 bags of stem cells in total, 4 on the Friday and 4 on the Saturday. That experience was, again, not too bad. With the Hickman line in place, it was a relatively straightforward exercise of just defrosting and then plumbing in every bag. In terms of a reaction, I did have a hot flush as a result of the preservative that they put in with the stem cells, but really hot flush was about it, and that wasn't too much trouble. 3 days prior to the stem cell transplant, they started me on an anti-rejection drug, cyclosporin, which was again IV. Unfortunately, that has to be administered quite slowly, and my administration was over 8 hours, which means that you're plumbed into a drip pump for most of the day, which is a little bit annoying, but that's about it. In terms of reaction to the cyclosporin, I did spike a temperature halfway through the first day, or towards the end of the first day. Again, I think it was a reaction to the drug as opposed to any possible other nefarious infection getting in and ruining my day. They took bloods, samples, cultures, so on, and the results came back with nothing abnormal found. So my understanding is that that was almost certainly again just a reaction to having something strange put into me. Sorry, that was not a reaction to the cyclosporin, that was a reaction to the ATG, the antithymocyte globulin, which is again the stuff that helps condition the body to accept the stem cells. The cyclosporin I've been on afterwards, and again quite a an annoying experience. The ATG was just for 3 days prior to the stem cells. Now, afterwards, a week later, we've been monitoring my blood on a daily basis, both to make sure that the level of cyclosporin is correct in my bloodstream, and also to see how things are going on in there. And I'm delighted to say that 2 days ago my neutrophils, which is the primary measure of the immune system activity, started to go up from very low, from a 0.4. They went up to 1.2, then the day after they were 1.3, and I'm hoping that they will be higher still again today. If that's the case, then it would appear that the engraftment has taken place, and the doctor at the weekend said that if that's the case, then they could be looking to discharge me and treat me as an outpatient. that means then that I've got to integrate back into society and get used to all of the various infections and things that can attack you from the wonderful world that we live in. So, long story short, I've got through it. I'm almost at the point where I'm getting back home. I'm not through all of the pain yet because I've got a load of vaccinations to go through, and obviously I've got to get all the infections that you get growing up in life. I've got 63 years to rebuild in my immune system, so that is going to be the next step of the journey. Here though, I think to all intents and purposes I'm just about done, and God willing, or the doctors willing, I'll be going home very, very soon. So thank you for listening to me drone on and on and on and on about my experiences here, and I hope that maybe for, even if it's only one person, if this has been some sort of help, some sort of assistance in understanding what happens when you have total skin electron beam therapy, total lymphoid irradiation, ATG, and stem cell transplant, then I've been of some little assistance. So thank you very much for listening, and I hope that everything goes well for you. Take care.